Hi, my name is Kelly. I'm going to be your nurse today to do a head-to-toe assessment. Can you tell me your name?
Lizzie Watson.
Lizzie, when's your birthday, Lizzie?
2/19/1991.
Excellent. And can you tell me who the president is?
Obama.
Beautiful. And how about today's date?
3/24/2016.
Perfect. Did you have any pets while you were growing up?
A dog named Toby.
A dog named Toby. And how about your first grade teacher? Do you remember her name?
Miss Bamer.
Beautiful. Lizzie is a 25-year-old adult female. She appears well nourished and in no apparent signs of distress. She's healthy, she's alert, and she's oriented, and she speaks clearly without any stuttering or without any lisps. I would take Lizzie's vital signs, her blood pressure, temperature, and pulse. Her respirations are even and unlabored. She has no apparent signs of cyanosis. We're going to start with your head, and we're going to work our way down, okay? For your head, just by looking at it, she has normal hair distribution. She has no parasites. Her hair is equally distributed. Her scalp moves freely, and I don't feel any kind of lumps or lesions or see any kind of exudate at all. From her head, also, we're going to look at just her sinuses. Any pain?
No.
Any pain?
No.
No. And we're going to test this temporomandibular joint. Can you go ahead and open and close? Perfect. Are you experiencing any pain at all today? No. Beautiful. If Lizzie were having pain, we could do a PQRS scale, or we could do a scale of 1 to 10, where she could tell me what makes it feel better, what makes it feel worse, what brings it on, and what the intensity of that pain was. We're going to test her facial muscles now. I'd like you to smile real hard. Yay. Bear down on your teeth. Frown. Beautiful. Go ahead and puff out your cheeks. Perfect. Do you have any trouble with tasting? We would do a taste test. Bitter, sweet, sour.
No problem.
No? Okay, let's do a little sensory and see if you can feel. Go ahead and close your eyes. And when I touch you, I just want you to say now.
Now. Now. Now. Now. Now.
Beautiful. For her eyes, we would check her eyes initially with a Snellen chart. We don't have one, so can you read the sign in blue over there, which is about 15 feet away? What do the blue letters say?
Volleyball.
And above that?
Citadel.
Perfect. Her eyes are symmetrical. Go ahead and close your eyes for me and open, and her eyelids move freely. I'm going to have you look down. Let me check the conjunctiva and go ahead and look up. Beautiful. It's pink and moist. Her sclera is white. We're going to check her pupils. We would turn the lights off, make it dark. Her pupils are round and they constrict, make it dark. And they equally react to light, which is perfect. We can look from the side. If you look straight ahead, we can check the cornea for any opacity, and it looks very clear. Perfect. I want you to follow. We're going to check extraocular movements. If you just follow my finger. Beautiful. Eye movement is smooth. Let's see what else we have. We have the cover test. How about that? I want you to hold this over one eye. I want you to stare at the green band on the wall. And as I look at her eye, and go ahead and remove it, and cover the other eye, and go ahead and remove it. Her eyes do not wander. That's perfect. We'll check the corneal light reflex. So I'm going to shine this light right on her nose, the bridge of her nose, and I can see the reflection equally in both eyes. So we have positive corneal light reflex. Her pupils equally react, and I think the eyes are good. There's no discharge and all of that around there. Everything looks perfect. Next, I'm going to check her ears. We'll visually inspect the external canal, and there's no thickening, there's no lesions, there's no drainage on either side. To To check the tympanic membrane, I would pull the pinna up, and with an otoscope I would look inside to check the tympanic membrane, which would be pearly white, concave, no drainage, and no perforations. To check her hearing, what I'm going to have you do, Lizzie, is hold a hand over one ear, and I'm going to say a word, and I want you to repeat it.
Pancakes.
Beautiful. And now hand over the other ear.
CrossFit.
Yes, we love CrossFit. That's perfect. If there were any discrepancies with that, we could do the Weber and the Rennie test. For the Weber test, I would hit the prongs, place it on the center of her head, and she would tell me if she felt the vibrations on the left side, the right side, or both sides. For the Rennie test, I would hit the prongs again, and I would hold it on the mastoid back here, and as soon as she quit hearing the vibrations, she would tell me, and then I would put it in front of her external ear canal, and again, she would tell me. The air conduction is twice as long as the bone conduction, so I would expect it to take longer for you before you heard the before you stopped hearing the tongs. From there, we're going to assess your nose, which looks symmetrical and without any lesions, scrapes, or zits, or any of that good stuff. I want you to go ahead and hold your one side of your nose, take a breath, and to the other side. So it appears to be patent. Good, no stuffiness today with all the pollen that's going on. How about smell? Do you have? I would ask her if we had different things that she could smell. Something were burning, something were peppermint. Any trouble with smell at all?
No.
Good. If I had a scope, we could check her mucosa inside by tilting your head back. We would check with the light. We could check for a deviated septum, but the mucosa is pink and moist. She's got normal ciliary hair in there to help filter that air. And if she had a deviated septum, that would be okay as long as it didn't interfere with her breathing. From your nose, let's move on to her mouth. I want you to bite down. Let me see your teeth. I see that her top teeth come over her bottom teeth, so she has good alignment there. I'm going to check the temporomandibular joint. Go ahead, open and close. Good. Any pain?
Nope.
Beautiful. Her lips are pink without any kind of lesions or cuts or bumps or ulcers, anything like that. Go ahead and open your mouth. And the oral mucosa, we can check, and it's pink and it's moist. Can you stick your tongue out? Lift it up. There's no vibration or tremors in there, and we see a little bit of vein underneath, which is totally cool. I don't have a tongue depressor. If I did, I would hold her tongue down to open up and say, ah.
Ah.
And so I see the soft palate rise. It's midline. It rises uniformly, and the uvula is in the center of the back of her, in the back of her throat, and it rises and falls symmetrically. And the teeth are ivory. That's beautiful. The uvula is pink. And the last thing we would do is a gag reflex. I would put the tongue blade on the back of her tongue, and she would go, yeah, beautiful. Next, I'm going to inspect her neck, and I see that she holds her head erect, and in its midline, I don't see any kind of distension or any marks, scrapes, anything like that. So we'll check some range of motion. Go ahead, look down, look up, look side to side. Good. In your ear to your shoulder. Good. Her movements are smooth and symmetrical. Any pain?
Mm-mm.
No. Beautiful. Let's check some spinal accessory nerves. Go ahead and shrug for me. Good. And down. Go ahead and turn your head to one side and cause some, I'm going to put resistance, and go ahead and push your face back to center. Good. And look the other way. Push your head back to center. Perfect. What's next? Lymph nodes. How about that? We'll start in front and under the chin. Lymph nodes are small, soft, round, not really very palpable. We check her trachea by finding the sternal notch, and I notice that